Okay, I'm going to try to do this as best as I can. I'm not sure if you can see my poster board, but it took me a couple hours, so I'm pretty proud of it. But I did my study at St. Joe's Mercy in Ipsy, and I did mine on a pseudo aneurysm. The help I had with this is Jennifer Taylor, who's an RVT, Anita Leggett, and the doctors that did this are Dr. Heinrich and Aziz. I'm going to start with what a pseudoaneurysm is. It is sometimes called a false aneurysm, and it's considered to be false because it must communicate with the artery. This usually happens when the vessel wall is injured and the blood is contained around the surrounding tissues. This usually happens after having a heart attack, but in my case, in my situation, the lady had it from after having catheterization, a heart cath. I'll talk about my case report. She is a 91-year-old female. She was having heart problems, trouble breathing, chest pains, high blood pressure, diabetes. So she went in 2 months ago and she got a heart catheter done. Her results, I do not have the information on that, but 2 months later, she was having groin pain in her right leg, she said. And so she had an order done for a DVT to rule out for a pseudoaneurysm. She did end up having one. It measured in at 4.8 centimeters by 5.8 centimeters. There was also partial thrombus inside, and that flow measured to be 3.1 centimeters by 3.6. It did have turbulent flow, and when this happens, it kind of looks like a yin-yang sign. So the color picture, which I'm not sure if you could see, shows that the red and the blue mixed together. And when you see a to and fro flow, it's usually called the yin-yang. The length and diameter of the neck was around 0.27 centimeters to 0.1 centimeters. And so this was a problem because she was having a lot of pain. So they wanted to do a thrombin injection for her. She went into surgery to get this done, and it was a successful injection, and her pseudoaneurysm ended up going away. So she survived after being 91. She made it through. I'm going to tell you a little bit about some other options that they used to do back in the day. That they still do now, but it's just not as common. They would do a UGCR, which is a compression repair for a pseudoaneurysm. And they would also do the one I just told you about, which is a thrombin injection to get rid of it. The successful rate now these days is, what I looked up, is 97% for a thrombin injection, which is really great. And it's also better than the compression because it's less pain for the patient and it's a lot less time. So that's really great that they discovered something like that. There's other mentalities to see if there's a pseudoaneurysm. They do MRIs, and they also do CAT scans to discover this too. So she had the MRI done, which is how they found it. So then they ordered the venous duplex to make sure she didn't have a pseudoaneurysm, which came to be that she did. It's really cool study that I got to see everything like that. I wish I would have been able to go into the surgery room, but unfortunately I had to leave that day. So I'm happy that she did survive this, and I hope to see more sometime soon. That's it. Here's my board. Thanks, guys.